Welcome to today's video, where we'll be exploring a rare and devastating neurological disorder known as Canavan disease. This genetic condition primarily affects the brain, and understanding it is crucial for families and healthcare professionals alike. Join us as we delve into the causes, symptoms, and management of Canavan disease. Canavan disease is caused by mutations in the ASPA gene. This gene provides instructions for making an enzyme called aspartosylase. Aspartosylase's job is to break down acetyl L-aspartic acid, or Na, in the brain. When the ASPA gene is mutated, the enzyme doesn't work properly, leading to a buildup of Na. This buildup is toxic and disrupts the normal development and function of the brain. Now, let's discuss the pathophysiology. As we mentioned, the malfunctioning aspartosylase leads to an accumulation of Na in the brain's white matter. This excessive Na disrupts the formation of myelin, the protective sheath that insulates nerve fibers. Without proper myelination, nerve signals cannot be transmitted efficiently, leading to progressive neurological damage. This process of demyelination and subsequent neurological impairment is the hallmark of Canavan disease. Canavan disease is a rare genetic disorder. It is most commonly found in people of Ashkenazi Jewish descent. However, it can occur in individuals of any ethnic background. Because it's an autosomal recessive disorder, both parents must carry the mutated gene for their child to be affected. If both parents are carriers, there's a 25% chance with each pregnancy that their child will inherit the disease. The signs and symptoms of Canavan disease typically appear in early infancy. Affected infants often exhibit hypotonia, or decreased muscle tone, making them feel floppy. Other early symptoms include poor head control, irritability, and difficulty feeding. As the disease progresses, children may experience developmental delays, seizures, macrocephaly, which is an abnormally large head size, and vision problems, including optic atrophy. The severity of symptoms can vary, but unfortunately, the disease is usually progressive. Diagnosing Canavan disease involves a combination of clinical evaluation and laboratory testing. Doctors will assess the infant's symptoms and perform a neurological examination. Elevated levels of Na in the urine or blood are a strong indicator of Canavan disease. Genetic testing to identify mutations in the ASPA gene confirms the diagnosis. MRI scans of the brain can also reveal characteristic white matter abnormalities. Canavan disease doesn't typically have further sub-classification. There were historic discussions of mild vs severe forms, but this is not a formal classification used today. The presentation of the disease is usually variable dependent on the mutation, and therefore the level of active enzyme. Unfortunately, there is currently no cure for Canavan disease. Treatment focuses on managing the symptoms and providing supportive care. This may involve physical therapy to improve muscle strength and coordination, occupational therapy to assist with daily living skills, and speech therapy to address communication difficulties. Medications may be prescribed to control seizures. Nutritional support is essential to ensure adequate growth and development. Research is ongoing to explore potential therapies. Since Canavan disease is a genetic disorder, prevention primarily involves genetic counseling and carrier screening. Individuals of Ashkenazi Jewish descent, or those with a family history of Canavan disease, should consider getting tested to determine if they are carriers of the ASPA gene mutation. If both parents are carriers, they can explore options such as preimplantation genetic diagnosis, PGD, or prenatal testing to assess the risk of their child inheriting the disease. The prognosis for Canavan disease is generally poor. Most children with Canavan disease do not survive beyond childhood. However, the exact life expectancy can vary depending on the severity of the disease. Current research efforts are focused on developing new treatments, including gene therapy, to correct the underlying genetic defect. These emerging therapies hold promise for improving the lives of individuals with Canavan disease. While significant progress is being made, there's still much work to be done in finding effective treatments and ultimately a cure.